Good morning, everyone, and thank you for joining us. My name is Brittany Resendiz, and I am the Member Communications Coordinator here at Commonwealth Purchasing Group. For those of you that are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. We're very excited to have Jim DeSimone, National Accounts Director, and Ron Corsi, Executive Sales Director at Quest Diagnostics, introduce our new partnership with Quest and discuss how your health center can cut costs and generate new revenue streams by partnering with Quest. Quest Diagnostics is the world's leading provider of diagnostic information services, offering 250 tests targeting cardiovascular disease, diabetes, endocrine disorders, and cancer diagnostics. The webinar today is designed to last for 1 hour, allotting us 30 minutes for the presentation portion and 30 minutes for the question and answer. As you can see now, your line is currently muted. When we reach the Q&A portion, you can type your question into the question box, which is located on the control panel. Or if you'd like to ask your question over the line, please use the raise your hand option, which is also located on the control panel. That will allow us to unmute your line so you can ask your question directly to Jim and Ron. So before we get started here, we'd like to open up a poll question. If you could just draw your attention to your screen. The question asks, what has been your experience in working with your current laboratory services provider? We'll leave the question open for just a minute or so all attendees have an opportunity to answer. And just keep in mind that all answers here are confidential and they will not be shared with anyone else on the call. Okay, great. So now I'm just going to close out that question and share the results on the screen so everyone can have an opportunity to see. Looks like everyone said that their service is currently meeting their expectations, but there is some room for improvement, so that's great. At this time, I'd love to hand it over to Jim. Thanks for being with us today. Why don't we get started?
Thank you for that very warm welcome. And as you can see, the agreement was signed back on April the 1st, earlier this year. Soon after, in early July, we had a press release announcing this new sole source agreement between Quest and Commonwealth Purchasing Group. As you can see, I provided a link below on the slide so that you can review the press release if you wanted to. We were able and early enough to get into the 2016 CPG Membership Savings Catalog, which I'm sure that Brittany and her team has forwarded out to the various members. We also, earlier this year, collaborated with the marketing team to create a co-marketing sell sheet, which I've included in the slide deck this morning, and I'll present that to you later in the conversation. And then internally, what we did here, within Quest, we have 6 different regions. So we held rollout calls to all the senior sales leadership teams back in July. We provided those teams with the CPG memberships to each of the regions. And what happened next was that the individual representatives that were responsible for certain geographies, they should have been out calling on your members, reaching out to those members where we do have the business today, providing information about the agreement, and then obviously where we do seek out an opportunity where we don't have the work today or where Quest doesn't have the work today, working with some of the members at each of these facilities to see if there's an opportunity that we can work together on. Also, we wanted to provide additional information soon after the agreement was signed, not just with the press release, and it was Brittany and her team again that suggested that we did an educational webinar, which we're trying to pull off this morning, and hopefully you'll find this helpful and interesting and more information about our relationship. As I said earlier, our sales leaders, it's a work in progress, reviewing that membership list with our internal commercial sales organization. There are many times in which we may not have relationships at some of the FQHCs that fall under the umbrella of CPG, and we will be working with the CPG sales organization to help broker meetings moving forward. And our marketing team at Quest recognizes that the market for FQHCs is growing, and we'll be introducing new educational sales tools that we'll be providing to CPG, and they can forward those out to you electronically. The last bullet I have on this slide is really about our fee schedule, which is the pricing, and we call it, internally call it a ceiling fee schedule. And because the members are in different states and there are certain regulations that govern each FQHC, and if you know one FQHC, you know one. So our local teams have the flexibility to be very competitive with not only the pricing and the economic savings that we can offer, but also the services that we can render. So that's a little bit about where we've been up to date. I'd now like to provide you with some information as it relates specifically to Quest. As you can see, and I didn't want this to be an infomercial about Quest, so I'll just go through some real highlights here. Quest annual revenues in 2014 topped $7.4 billion. What I would like to point out that of that $7.4 billion, $1 billion was in hospital sales, so the remainder was in the physician marketplace, which FQHCs and community health centers fall under that umbrella. Quest employs over 44,000 folks around the country. A couple other tidbits which I thought were important to bring up on this morning's presentation. We touch over 30% of all the Americans in the United States. That means at one point, 30% of the U.S. Folks come to a patient service center within Quest for whatever reason, if they're sick or it's an annual wellness check, and those tests go into a Quest lab and the results go back up to the clinician. We have the business in 50% of all the physician offices throughout the United States, as well as we have approximately 52% now of all the U.S. hospital market. An extraordinary fact here on the slide here is that each night, 365 days a year, there are over 500,000 specimens that go through a Quest lab. Inspiring action through insight. That's Quest's new brand. At Quest Diagnostics, we work every day to transform knowledge into insight. We want to empower your clinicians with the needed information to make the right decisions. Our goal is to be a partner in 3 areas. Diagnostic information, which speaks to the superiority of our lab services. Advanced analytics and technology services, which Ron is going to talk to you about in a little bit, as well as our broad portfolio of specialized solutions, which I'm going to touch on in the next slide. Our 8 clinical testing franchises are constantly working closely with our research and development teams. We focus on various disease states or clinical problems and coordinate with our commercial sales organization to deliver new and improved solutions. If you look at just one of the franchises up there, Women's Health, we extend a comprehensive test menu spanning the continuum of women's care, supporting the diversity of our female health needs. Each one of these franchises has and I'm going to call them a sales team, but we don't really view them as a sales team. They're more consultants out in the marketplace. So when we introduce new tests specific to these clinical franchises, whether it be cancer diagnostics, women's health, or neurology, they will be in there presenting new data to not only the lab folks, but the clinicians within your facilities. Again, we consider these folks as highly trained consultants versus the commercial sales arm. As you can see, we offer the most extensive clinical testing network in the United States. We operate 24 hours a day, as I said earlier, 7 days a week, 365 days a year. We touch the lives of patients of more than 147 million times last year. We have 8 hubs across the United States. We have 4 esoteric labs, and we have 2,200 patient service centers, again, throughout the United States. What I haven't even showed on here, we have our own air fleet. We have approximately 7 planes right now that take off each and every evening, picking up specimens and dropping them to the various labs across the nation. We conduct advanced esoteric testing in our world-renowned Nichols Institute and Athena Diagnostic Laboratories. Esoteric tests offer innovative options in the areas of molecular diagnostics, protein chemistry, cellular immunology, and advanced microbiology. We have one of the largest medical and scientific staff in the industry, many whom are recognized leaders in their field, including genetic counselors. This group alone in 2014, introduced over 150 publications providing insight into diagnostic testing. As you can see, we offer a wide range of flexible strategic collaborations. One of the ones that I'm going to hone in on, if you look at the middle of the slide, our lab management service. We offer a partnership that we can customize to meet specific situations and needs. When we go into a hospital, and as you can see right now, we have 50 hospitals that we manage nationwide. On average, our valued partnerships have yielded significant cost savings, up to 15% for a typical 400-bed hospital. Brittany, I'm going to turn that back over to you. I think we have another poll question.
Great, thanks, Jim. As Jim mentioned, we're going to open up another poll question for you now. If you could just draw your attention to the screen, we'll be broadcasting that. And the question asks, based on the information shared thus far, has this information provided you with a broader perspective on the value of Quest Diagnostics, yes or no? And we'll open that for just a couple minutes here so you have the ability to answer the question. Okay, great. So I'm just going to close out the poll question now and broadcast the results so you can see them on the screen. Looks like everyone has been pleased so far, so that's great to hear. And at this time, I'm going to hand it over to Ron Corsi, who will be picking up for the rest of the presentation.
Good morning, everyone. What I'll do is I'll try to keep the pace. And what I want to do is just move you toward a little bit more around what Quest seeks to provide in terms of technology solutions beyond the lab testing that everyone's used to us doing. With this broad database of information that we have that we feel provides great insights to how prescribers and orderers can treat patients, we've created a new brand called Quest Quantum, which takes our connectivity solutions and our data and brings what we feel is innovation through our analytic offerings. This portfolio of solutions is designed to basically, one, assist clinicians in analyzing information, such as provider performance and observing gaps in care. It sits on a platform that enables us to connect clinicians to the broader healthcare community with their patients. And then lastly, it creates an ability for education, empowerment, and engagement for this healthcare community so that way we improve healthcare in a collaborative manner. Jim, as you go to the next slide, many of you are familiar with our Care 360 platform if you've worked with Quest in the past. And what we've done is we've worked internally to improve our tools and our technology, and externally with our partnerships. That way we can meet these broader demands of the healthcare environment. And as you see with our Care 360 tool, which about 400,000 physicians use it to provide both practice management and revenue cycle management, but also use it for its EHR capabilities. In our broad-based program, clinicians can order labs, receive results, get alerts and notifications around quick patient needs that need to be addressed, as well as review trends in ordering patterns and around patients' results. Our second tool, the MyQuest tool, which about 3 million patients nationally have enrolled, is an app program that a patient can download onto their mobile device and allows them to view their lab results and also assists with the practitioner in keeping the patient engaged in their health care. Jim, next slide. When you go a step further, what I wanted to talk about on this slide is around how we take this vast collection of our data and this database and then move it through this Quest Quantum solution and work to basically provide what I feel are 3 types of reports. As you'll see on the examples on the reports, we take these capabilities and we know things like providers' ordering habits, how they're performing around key metrics, and we're able to provide through this aggregation of data 3 types of example reports. This utilization analysis, which you see on the top part of the slide, to provide insights on how testing is utilized by practitioners, things that may be out of the norm, and where practitioners, for example, may be ordering higher price tests. Around population management, we're able to identify gaps in care that are specific to lab results. So, for example, we can identify where patients haven't had an A1C in the last 12 months. And in our third, we can do basic reports on quality metrics, for example, like on HEDIS performance. Jim? And then the last thing I want to share is around, I mentioned we've done a lot to enhance what we provide internally, but we've also made a number of collaborations externally, so that way we can bring the best of what we around our data and provide better focus with our partners around some of the solutions you're looking for out in the marketplace. Our data diagnostics solution within Quantum, there's a fee associated, but it highlights this partnership that we have with Inovalon, who is an expert in data analytics. Through data diagnostics, we take this collection of this data that Quest has, the data that Inovalon has through working with payers, and it works simply like this. A patient's in with their doctor, a doctor is able to order via Care 360 or their EMR as if they're ordering a typical test, and they order this data diagnostics test. The order is then submitted through both Quest and Inovalon, where Inovalon's contracted with payers, and then the Quest portion, it goes through the Quest database, conducts about 200 quality checks, pulls in patient prescription information, and in a real-time manner, in about 5 seconds, it produces this PDF right at the time of service that gives the practitioner, for example, on the right, a medical history report. It identifies gaps in care and a prescription report. So that way, as a practitioner, as you all work within your facilities and your organizations are trying to identify not only gaps in care, where we're over-prescribing or over-ordering, and making sure that if you don't need to order an A1C if someone had an A1C within the last 6 weeks. It provides the practitioner an opportunity to be able to then make much more informed decisions around the patient care at the time of service. So Jim, what I'll do is turn it back over to you, but I want to just make sure I gave everybody a highlight of some of the additional capabilities that Quest has by looking at the data we've been collecting over the past 20 years and providing care in collaboration with your providers. Jim?
Yep, Ron, thank you. We've got 3 more slides left. 2 of them have to do with the cell sheet that I spoke about earlier. But again, I just wanted to provide you with a little bit more information about some of the extended services that Quest has. As you can see, we have 7,000 mobile phlebotomists that are out there. As I mentioned earlier, we have 2,200 patient service centers across the country, and that's growing each and every day. We've gone to a specialized call center where we have a call center in Florida, one in Kansas City. All calls are routed there. They connect that information and send it back to your clinicians or the physician offices where the calls came in. We're trying to change as an organization across the board. I've been here 6 years now, and I've seen more changes in the last couple of years to try to make it easier for both our patients, physicians, and the clinicians that use our services. We are improving patient outcomes and delivering care, as Ron mentioned, through new IT services that continue to grow each and every day. So with that said, I'm going to just show you the 2 slides that we created collaborating with CPG. It's something that Brittany and her team can send out to you if you haven't received it already. It's really just like a cheat sheet, kind of goes over a lot of what Ron and I spoke about this morning, but it's specific to FQHC. As I said, it's two slides, and we can get that out to you if you have not seen that yet. So we're winding down with the formal part of the presentation. I think we've got 1 more poll question, and then Brittany's going to open it up for any folks out there that have specific questions for Ron and myself. Brittany?
Great. Thank you, Jim. As Jim mentioned, we do have that cheat sheet marketing flyer, and I can send that to you. What I'll do after the presentation today is I will send you the recording from today, and I'll include that on there. But before we open it up for questions and answers, I would like to open up the last poll question. So if you could just draw your attention to the screen for one last time, and I will launch the question there. The question asks, would you be interested in a further discussion with the leader at Quest regarding the information shared today? Basically, this is just to give us some insight on if you're interested in learning more. We'd be happy to reach out to you directly, and we will have someone at Quest do that as soon as we get off the call here today. Okay, great. Thank you all for your responses there. And I'm just going to hand it back over to Jim and Ron to answer any of your questions that you may have. As I mentioned earlier in the introduction, if you have any questions for Ron or Jim today, you can type them into the question portal, which is located on the control panel. Or if you'd like to ask your question directly over the line, we can unmute your line if you use the raise your hand option.
And Brittany, I'm just going to add this. Sometimes folks, when they're on calls like this, they're hesitant to ask the question. Earlier in the slide deck, you saw my email, you saw my cell phone. If you've got questions that you want to ask myself directly, please do not hesitate.
As Jim mentioned, we will be including his contact information when we email you regarding the recording of today's presentation. That way, if you do feel more comfortable reaching out afterwards, or if you share the slide deck with your team and someone else has a specific question they'd like to reach out directly, they may do so as well. It doesn't look like we have any initial questions. With respect to time, I would like to close out the webinar a little bit early, and as we mentioned, we will be emailing you so you can ask your questions later on. But first and foremost, I would just like to thank Jim and Ron from Quest for being here today and hosting our presentation, and we hope that you found the information to be helpful and beneficial to you and your health center. And again, if you'd like to learn more, please do not hesitate to reach out to anyone, either Jim, Ron, or myself, Brittany, here at Commonwealth Purchasing Group, and we'll be sure to assist you as soon as possible with more information on Quest.
And with that said, I also want to wish everyone a happy and healthy Thanksgiving.
Thank you so much, Jim, for being with us. And Ron, take care, everyone. Have a great day, and happy Thanksgiving.